there are over 10,000 rare diseases, 95% of which lack an FDA-approved treatment. As enacted, the IRA disincentivizes post-approval research and development and seeks additional indications for promising treatments. This will acutely impact pediatric patients, who by their nature make up a much smaller subset of the total population. Dr. Thompson, thank you for being here from CHOP in Philadelphia. Is a decline in the research and development investment in pediatric research a concern? And what impact will that have long-term on the patients that you treat each and every day?
Thank you, Dr. Joyce. I think that there are some phenomenal opportunities to continue to make progress, not only in pediatric health, but also in the health of Americans overall, when we have the opportunity to intervene, to diagnose children and to treat them, largely coming from innovation. The ability to incentivize manufacturers to continue to stay in this space for rare diseases has been extraordinarily helpful. There have been challenges with the continuum to determining what will actually be paid for in terms of insurers. And I do think that that continues to be something that we need to be very mindful of, because it is not entirely clear that the incentives that are there to manufacture the drugs are being paralleled with incentives to actually cover them in the clinical space.
Dr. Thompson, programs like sickle cell disease and other heritable blood disorders, Research, Surveillance, Prevention, and Treatment Act help bring much needed hope to the rare disease patient communities and help spur the research and development that will add new and improved treatments for these rare diseases. How can the lessons that we have learned from this program be used to support research and treatment for other rare diseases?
I think that the rare disease community is energized and is quite unified in trying to continue to learn from each other on how we can best go about that. Some of them are private-public partnerships. There certainly are a number of nonprofits that have been very active, especially family foundations, in bringing some of these things to our attention, encouraging science and following the science, and looking at ways to bring innovation from the bench to the bedside is, I believe, one of the things that many of our academic medical centers do quite well. I think without taking full advantage of the innovations, the breakthroughs that are occurring in sickle cell disease, if we don't take advantage of those in this patient population, it really does send a message to those who are suffering from other more rare diseases. And so I think embracing this in sickle cell should be a very positive message to all.